All right in the middle of Obamacare enrollment, a judge in Texas has ruled that Obamacare itself is unconstitutional, more to the point that a key funding mechanism for the so-called individual mandate that you got to get health insurance isn't wise. He goes on to say, I'm referring to Judge Reed O'Connor, that it can no longer be sustained as an exercise of Congress's tax power. Now, this will no doubt be appealed, but the back and forth continues. The read on all of this and what it might mean for the future of health care, and particularly Obamacare, with former New York Congresswoman Nan Hayworth. We got Democratic strategist Jessica Tarlov and Fox News contributor Kat Timm. Kat, what do you think of what happens now?
Well, obviously it's going to be appealed, and this is going to be an ongoing battle for quite some time. And it's interesting because the individual mandate was already struck down. Well, the penalty wasn't technically struck down. The penalty was just reduced to $0. But I think that it is unconstitutional. I'm surprised that it actually passed in the first place. So I think that this is exciting news, even though I don't know ultimately if it will end up being struck down or not, or if it will even make it to the Supreme Court.
All right, well, that depends on some legal vehicles here. But, Nan, you can always say that it's going to be framed through political prisms, right? I mean, Democrats are going to say millions are going to lose their insurance, people are going to die. Republicans are going to say millions of people will save money now, they're not going to die, and on we go.
And in fact, Neil, the statistics show that the folks who gained insurance coverage through Obamacare were primarily folks who gained through the Medicaid expansion, which is a separate argument. But basically what Obamacare forced millions of Americans to do who are in the individual markets who could least afford this was the government compelled them to buy insurance policies that effectively were overpriced for what they needed. And that's been the entire thrust of the president's arguments and of the Republicans' arguments, that people should not be forced to buy insurance that's more costly than they need and that provides for things that they don't necessarily need. So,
but it is going to spook those signing up for it, right? I mean, you're going to think twice about.
If you are watching right now, Obamacare still exists. The deadline is coming up. Please register and sign up. If it goes back to the Supreme Court, the same 5 justices who voted to preserve it are still sitting on the court, and I imagine that their decision will be the same. But what I'm struck by is the Republicans that are rejoicing in this after the 2018 election, where it was very clear that health care was the #1 issue and that people wanted to maintain pre-existing conditions. And a number of Republicans went out there and actually lied about their longstanding position on pre-existing conditions in order to get people to vote for them. What this judge has done is called all of that work that those Republicans who were smart enough to pivot into question, because what are they going to do now? The Republicans still
You're saying they lied about as much as they sit with the powers in states and said the states themselves could decide.
They lied by saying, I have always been there. They're on the record. We have the tape, roll tape, as they say, saying that they want to repeal and replace Obamacare. They will have another plan, which they never did, that was viable. And then they come back and they say, we always wanted to protect your pre-existing conditions.
Did Democrats lie in any of this when they misrepresented the cost of this, what was covered in this?
I've done that.
So there's been bipartisan lying
I'm
going
saying
on.
after you lose 40 seats in the House, you should, and healthcare as a #1 issue, you should not be rejoicing in a fight over something that the American public wants. Put forward a viable.
Do they want this? Do they want this?
Well, they want it. Really, a lot of people want Medicare for all, which I think is where the Democrats will now shift to say we've got to make sure everyone is protected.
It's not a matter of, I would, Jesse, with respect, I would dispute your premise. Republicans have always been for everyone having access to insurance that they can afford, and that includes allowing states who are the best at taking care of their local citizenry to allow them flexibility with Medicaid so that, yes, folks who have pre-existing conditions in particular can be better provided for than they are. Millions of Americans have lost their insurance under Obamacare.
It is true that Republicans really dropped the ball on this. They had the chance to fix this. They had,
I agree.
They had the House, they had the Senate, they had the presidency. And
but we didn't have 60 votes in the Senate.
All they did was fight over this. And it is a complicated issue, and it is an emotional issue when you're talking about health care, health insurance.
Overturn this if it did get to that? What would happen?
I don't think so, because as Jessica said, the 5 justices that voted to protect it are still on the court, so I don't think that it would get to that point.
But what's changed by law is that now the individual mandate, although technically it still exists, is $0. So the IRS isn't collecting anything.
We shall see. And there's no way of guaranteeing a repeat vote that would turn out the exact same way in the United States Supreme Court. Nevertheless, we are going to get the read from Missouri Democratic Congressman Emanuel Cleaver on all of this. He's been a big believer that the law, flawed as it is still the best thing for the American people. Is he right? After this.